tomorrow you don't have funds. Do you stop the program? That's not sustainable. So find something that's sustainable. Suppose you're going to work for a smoke-free campus in your college. If you're in a college, I don't know if you're a smoke-free campus, but what if your students together can say, hey, secondhand smoke, and you will hear from the smoke-free co-chair gradually about how those efforts can be started, right? So that's the difference between one-day health fair, where there's no evaluation, there's no much follow-up, compared to a policy systems and rapid change where you have a specific policy that has been passed, so you have a before picture and then a picture to show success. We need to tackle it along with Vicky, we need to tackle it along with the community organizers, along with our community members, so we can get the diabetes rate low down in Fulton County. So let's join forces with Vicky and win this diabetes battle. Okay, thank you.
So, my name is Vicky Carnes. I'm a registered nurse. My background is in as a diabetes educator in the Free Clinic Network, or now called the Charitable Care Network. So, we're going to talk about what the healthcare safety net is, review diabetes, resources, that's the bulk of the presentation. And then at the end, I'm also providing the information on healthcare reform.
So, Ken Lazarus, our Smoke Free Coalition co-chair. Thank you.
Good morning. How's everybody doing? I'm happy to be here. I'm the co-chair of the Smoke Free Coalition of Fulton County. You may be wondering who we are, and we are working to decrease the tobacco use in our county, and we are happy that you're here. We consider all of you family members. We really want to make sure that we have all of you engaged in this particular process with our parent umbrella, the Health Promotion Council, but all of the coalitions. And so as we look at our membership, the Smoke Free Coalition Fulton County is a diverse group of concerned citizens who seek to reduce the health and economic burden of tobacco use and increase awareness of tobacco control issues among community members and policymakers in Fulton County.
Couldn't jump very much.
Okay, so she tried to jump rope. So physical activity, she could not engage properly in physical activity, so that was a barrier. Respiratory, circulatory, that was a barrier. So she wanted to be healthy.
I just had to leave it alone because I guess until a person just really wants to on their own stop, it's just not going to matter if I show him or tell some information about somebody getting cancer, getting sick.
4 is poison prevention. In 2009, 76% of poison deaths were unintentional. 8% was intentional. That is an amazing difference. And also, poison is only second to car crashes. That is absolutely a lot.
The unique thing about the health department, they report directly to elected officials, and being concerned with their constituents, commissioners in 7, 6, and 5 districts found out they had a high prevalence or increased incidence of asthma in those health districts.
So education does breed knowledge, and with everyone involved, the student as well as the parent as well as the school administrators, everyone could pitch in and make it better for the student.
How do you pronounce your name?
Miria.
Miria, beautiful. She just talked about a collaborative care model, right? That everybody's working together for the common goal of reducing and transitioning patients in an environment, going to an environment that doesn't support wellness, and transitioning them into a space where environmental concerns are navigated, social economic concerns are navigated, pharmaceutical concerns are navigated, and the overall healthcare paradigm is navigated. Pretty cool stuff. Mrs. Passons came to see us at Rite Aid to educate pharmacists on what they could have done to prevent her child from dying. That's how serious we are about this initiative. And we've made a commitment, Richard and I, that we won't leave you without showing the two faces of the children that we fight for every day.
Enabling and encouraging all within your sphere of influence to reflect your support during the day-to-day activities for the benefit of the entire community, so that more families don't come home to find what happened to Brendan and Kellen. Thank you very much.
So I heard a lot of people talk about race. Anybody know what race I am? Sorry.
Cuban.
No. Just a white boy, that's all I am. If you guys, no. So what's the take-home message here? Take-home message is that diversity, culture, intercultural competence is a lot like an iceberg. And I apologize, you guys probably can't see this too well, but here's the water line right here. And then above it you have just a little bit of iceberg. And down below it, so much more, right? So diversity is like an iceberg. We can only see about 10% of that iceberg above the surface. The rest of that is all inside, and we don't really know. So what does that mean today? Why do we talk about intercultural competence today? Well, you guys are now public health professionals. You leave today, and each one of you, whether you came in with a degree or any background in it, every one of you is now a public health professional and is going to be working in the community as a resource champion. So when you're working with these individuals, you have to remember that you can't make assumptions. You can't make assumptions about their health background, their cultural background, their experiences moving forward, just based on that 10% on the surface.
You can have a seat, and I'm going to turn it over to Cornelia. That was just to get us moving out of our seats a little bit.
Consider coming out to our meetings. We meet the second Tuesday of the month at the Boulevard location, so please consider being part of the Healthy Heart Coalition, because we really have to drive these numbers down. One of the things that we want to talk a little bit about right now is the vending machines. Raise your hand if you have unhealthy vending machines in your community. Okay. Now, let's raise our hands if we have healthy vending machines in our community. So does anybody know why maybe we don't have healthier vending machines? Any ideas you'd like to share with us about that?
Oh, I was just going to say, I was talking to one of my frat brothers, and he's in the vending machine business, and he says healthy vending machines is not, like, it doesn't make a profit as much as unhealthy vending machines.
Any other ideas? Yes.
Well, he's correct about that, because in most of our communities, there's too much salt, too much sugar in those vending machines. And then we need more people to comment about making other choices so that you get the healthy things in there. Because once you make a comment and you bring it forth, then change and modification comes forth.
We just want to encourage you to help us come up with the solutions and the responses to this, because we know the factors are all over the place in terms of why it's not happening, but at the end of the day, you can see the consequences every day.
I'm Leslie Magnum. I have an exercise program called 10 Again, and this afternoon I'm going to give you a segment of it. So everybody, get up. Move it! Sweep the arms up, big stretch, and down slow. Up again, big stretch, and down slow. Last one up. Bring the hands together, reaching for 10, 9, 8, 7,
about three things. One, community. Two, commitment. And three, leadership. I'm going to do that by telling you about me. So you have to listen for leadership, community. I said so. Fulton County is the greatest community on earth. As far as I'm concerned, you are on holy ground. You are on ground that has been set aside. I work with farmers. Some of you may have heard that there are farmers in this state who are victims of race discrimination. They didn't get the loans that the big guys got, so they weren't producers, and because they couldn't produce, they're called what you call limited resource farmers. Well, think of this. Think of this. Fulton County, somebody in the health department said, what would happen if we got those farmers who have limited access to markets to grow fresh produce and bring it to the city and put it in neighborhoods where they don't have fresh produce? We're talking about a genius. We're talking about an economic development genius somewhere in Fulton County. I haven't met the person yet. Don't get me wrong, I'm looking. I got my Google working and I got all my networks working. And who said that? Who set that up? Because they're geniuses. We have 2,979 farmers in the state of Georgia who would love to have access to the markets that you represent. You just stood up and posed yourself. I saw you. You just stood up and talked about how you love yourselves. I'm sitting here, I'm watching you. I'm watching you do all this stuff. I have never been in a room full of people who felt this good about themselves after talking about what you have been talking about all day. I've never been there. I've never had the experience. What I'm positioned for is a revolution in Fulton County. A revolution in Georgia. Something is about to happen in Georgia because of the commitments that you have made, because of the choices that you made. You didn't have to be in here today. You did not have to say, yes, I want to be involved in something that changes the way we distribute fresh fruits and vegetables in this city. Because that's what you're talking about, isn't it? Huh? I didn't hear anybody say anything about, oh, well, what we really need to do is eat more red meat. Huh? Come on, hands up. I didn't hear that. I heard people say fresh fruits and vegetables. Fresh fruits and vegetables. Say it with me. Fresh fruits and vegetables. One more time. Fresh fruits and vegetables. The moment you open your mouth and say that, you're talking about my guys. My guys can do that. They're set up to do that. Fulton County government has said, we want to do so. Here I am, the private sector commitment to deliver fresh fruits and vegetables at the scale and scope and quality required to eliminate food deserts in Fulton County. I don't want to live where there are food deserts. So I have taken it upon myself to see to it that we do something to stop it. Come on, it ain't rocket science. We know where the farmers are. We know where the products are. We know how the prices are created. We know how to do this. We can get the fresh produce to the people who need it at prices that are indeed not only workable, but the best prices on the street. That's our commitment. And I said something about Seventh-day Adventists, didn't I? Yes. I'm almost done. I still got another minute, I know. Okay. I want to say this and close because the next 3 minutes are going to be on you. I'm very serious about my Christianity. I don't believe that the way I worship allows me to be conscious of problems of the scale that we're talking about, and I do nothing. So I went to my church and I said to them, look, you have the finest set of hospitals in the country. Loma Linda University. Some of you, go online, look it up. Loma Linda University. You represent people who tend to live longer than any other people on the face of the earth. Seventh-day Adventists live longer. They live longer because they eat differently. I asked my church to get ready to come to Fulton County and bring the resources, bring the technology, bring the information, bring the system, bring the methods, bring the information to people who need it. And they said yes. So, I'm standing on hallowed ground. Fulton County is a very special place. When you walk out of that door and you're on your way to wherever it is you came from to get here, you are on your way with information that you didn't have before you got here about how we can do something to correct this. Am I right? Yeah. Nazir, Rob, is that right? That's what the purpose of this training was here today? To see to it that people have more information to do something to correct it. Am I getting through? Do you hear what I'm saying? I want your names. I want the list of everybody that was here at this meeting. I want to be in touch with you. I want you to be in touch with me. I want you to go to my website. I want you to go, let's do email. Let's be back and forth and talk. Me and the beautiful one over here are going to get into, we're going to do this. You got me jumping up and down. I see it. I want to be healthy. I want to be healthy. I want to live as long as I can. I got work to do. I got things to do here. I'm going to stop and give you the last two and let you tell me, did you hear anything about commitment? Yes. Did you hear anything about leadership? Did you hear anything about the community I represent? Yes. Then those are the things that ought to move you to duplicate it wherever it is you came from. Straighten your commitment out. Get your integrity together. When you give your word, you better stay with it. You stand up there and hold yourself. I expect you to act like you're in love with yourself. You hear me? And if you're in love with yourself, then we can do this. We can do this. We can do it together. Any questions?
Your website.
Your website. I'm sorry?
Your website. Your website.
Center for Family Farm Development. Long title. Center for Family Farm Development.com. I'm in the private sector. I don't work for the government. I partner with the government to get done what government can't do. It can only be done by private people stepping up and saying, hey, we heard you. We know what you're talking about, right? If you will make it possible for us to do this without interference, we'll take the responsibility and get the job done, all right? All right. We know how to do it. We know who we are. We know how to, come on. And we're all happy people. We all love ourselves. We know each other. Thank you very much.
I just want to first thank you for sitting here throughout this long day and sharing with us the information. Before I go into the PowerPoint, because the PowerPoint is just a quick overview of what the Women's Health Network is about, I just want to give you a little background about myself and why I find this particular avocation is very, very important. And I see in the room we have lots of women, men, and of course we all have mothers, so this topic is very important to all of us. Interesting enough, I want to say, of course, we save the best for last, because the women health is such a broad subject, and we have so many issues that we would like to address in reference to women's health. I'm not from Georgia. I'm originally from New Orleans, Louisiana. And in New Orleans, culture is very, very important to us, and tradition is very, very important to us. In New Orleans, growing up as a young lady, we had generational doctors. My great-grandmother went to one doctor. My mother went to the same doctor. I went to the same doctor.
What are we here to do? The name sounds pretty, the name sounds great, but how does that improve the health and the economics of people across this state, people across this county? We're going to talk about that. We're going to talk about what it means to be a community resource champion. What are our goals for the day? What are we trying to do? We're going to talk about that. Because with everything, you have to have purpose. You have to be intentional. When I travel across the country, and I look at the people I respect, some of the people I respect don't make $1 million. But when I go to LA and I see a mother that stood up in the community and that has changed her community, I respect her. It means a lot to me. So today, when you complete this session that I have, and we're going to be discussing some complex issues, some very simple issues, you're going to understand how to change and elevate the health and economics in your community and in your life. Who has the economic power? Is it just the wealthy people?
No, all of us.
Right.
All of us.
Okay.
Every one of us, no matter what income.
The decision makers, the government.
No, we put them in there.
Before we answer this question, we have a little debate, and I like controversy. I just watch CNN, so controversy is good.
I don't think there is any more controversy. Economic power belongs to us, as she said. It belongs to the community, it belongs to an individual, it belongs to the society at large, and definitely belongs to a government. Persons who can make the rational choices among the scarce resources, whether it is at the individual level, or at an organizational level, or the community, or the global level.
Okay. All right. Now let me put you on the spot. Do you think sometimes we give our power up, or we defer our power?
We defer our power because sometimes we do a very uncertain judgment among decisions, or we overjudge things, we override things, we take advantages of the privileges we have been gifted with.
And your last, can we use economic power to change our health?
Of course, yes, because health is nothing without economic power.
Okay. You heard it from your colleagues. Economics is connected to health. That's why you're here. When we get into the heart of our presentation in a few minutes, you'll see that a lot of people are self-medicating. A lot of people are their own doctors. But one thing I hope you understand as a community resource champion is that you have to inspire people. See, you can't empower them because that's not sustainable. You know why? Because if I'm just constantly empowering his leg up, moving his leg, that means I got to stay there the whole time. Sustainability is inspiring Warren to be his own man, to get his own education, to take care of his own FICO score. So when you max out your credit, that's a negative. So you want to use credit on a very limited basis. Okay, because if you get it up to 80%, very bad. Every card you use should be below 20%. Okay? Because one of the #1 reasons people went bankrupt is, well, a couple of reasons, but the issue is the health bill, okay? Now, what SCORE is, they're a group of free retired executives. They'll come around and talk to you about starting a business. I deviated from working because some people have had to start businesses. They're also in the book, in that section, there are ideas for starting your own business and working online. And all these have been checked out by Clark Howard. I didn't just put the con games on there. 6 to 8 week series, so that once you come out this process, that you are capable and proficient enough to go out into the community, and you'll have training in communication, more in-depth training in all the disease groups, so that you feel more confident, and also training in economics. So we're going to continue. This is only the beginning. This is an innovative program. It's innovative because of you. Co-chairs, we have some of the best co-chairs out here. Vanilla, Devin, Ken Lazarus. We have all of the Vicky Carnes. You had some great presentations today. So, and Richard. So, and also the interns. Raise your hands, because you're the future. No, you're today. You're today. So I thank all of you. You guys were doing great work. And so We want to, yes, we also want to remember, a little bird is telling me something here, evaluation form. Yeah, evaluation forms. So we need to make sure that you complete those. I'm not going to tell you what you're going to get, but there's something special you're going to get. Not today, not tomorrow, but in the mail you're going to get something for completing that evaluation. So complete the evaluation and come to the next series, and you'll see the return on that value. But we need your evaluations, and we need you to complete that. And pay attention to your email. We're going to send you notification on when we start the series, because we're going to start the series and continue the training for community resource champions. So I want to thank you. Your next steps are, please let everyone know about this training, because we're going to kick it off, and we're going to be expanding our classes. So, is there anything else? All right. All right.